My name is Kaycie, and the population that I am presenting on is the hearing impaired and deaf population. So an overview of what I will be talking about, I will be going over some background information, why the hearing impaired and deaf population is considered at risk, how society views them, their barriers, their specific needs, their resiliency factors, and what historical events have influenced the hearing impaired and deaf population, and also some resources for them. So some background information. Over 5% of the world's population is affected by hearing impairment or loss. That is roughly 430 million people, 34 million of which are children. Disabling hearing loss is hearing loss that is greater than 35 decibels in the better hearing ear, which is the ear that you can hear the best out of. Hearing loss can be mild, moderate, moderately severe, severe, or profound. It can affect one ear or both and leads to difficulty hearing in conversations and also around loud sounds. Hearing loss can occur at any age. That includes the prenatal, perinatal, childhood, adolescence, adulthood, older age, and factors across the lifespan. Hard of hearing people have hearing loss that ranges from mild to severe. The prevalence of hearing loss increases with age. Of those who are older than 60, over 25% are affected by disabling hearing loss. So why is the deaf and hearing impaired population considered at risk? Nearly 80% of the deaf and hearing impaired population live in low-income or middle-income countries. However, issues occur in all countries. As general access to healthcare needs increases, so do challenges in treating these patients. People with hearing loss have been shown to receive a lower level of care because of their inability to communicate with healthcare providers. This lack of communication can be increased by limited time to evaluate patients and establish rapport between patient and provider, and also by lack of access to interpretation services. So how does society view this population? The deaf and impaired hearing population is surrounded by a substantial amount of stigma. They can encounter stigma doing everyday tasks such as checking out at the grocery store, interacting with their doctor, and even trying to talk over dinner with friends and family. This stigma can manifest in several ways. This could be something like a rude comment made toward the hearing impaired or deaf individual, purposefully leaving them out of a conversation, or treating the individual differently because of their impairment. This can make the hearing impaired or deaf individual feel invisible, undesirable, and even of lesser value. This is obviously not true in any way. However, it is important to understand the impact that words and actions can have on people, regardless of impairment. So, some of the barriers of the deaf and hearing impaired population. Sign language is the primary language of the deaf population. The problem is there are different variations of sign language and not everybody knows sign language. There are hundreds of variations throughout the world from various contexts and scales in which they are used. National sign languages are the most widely used and have often emerged from deaf schools or deaf families. The most notable and widely used sign languages are American Sign Language and International Sign. It is more difficult for people with hearing impairments and deafness to get a job than those who can hear. According to the National Deaf Center on Post-Secondary Outcomes, or the NDC, only 54% of deaf people are employed compared to 70% of the hearing population. Employment rates are lowest among the deaf-disabled and deaf-blind population at 32% and 35%. Some of the specific needs of the deaf and hearing impaired population are increased availability of qualified sign language interpreters. These can be both video and live interpreters. Some extra time for communication in an appointment setting. So if somebody with a hearing impairment goes to a doctor, they may need more time to develop that patient and provider rapport than somebody who can hear well. Access to hearing aids, implants, and sound amplifiers, more inclusive workplaces, fair and respectful treatment, the ability to advocate for themselves, and also counseling services equipped with the ability to effectively communicate and listen to somebody who has a hearing impairment or is deaf. So some of the resiliency factors that we see in the hearing impaired and deaf population are that they embrace their identity, they embrace their skills and their capabilities. They may not be able to hear, but that doesn't mean that they don't have other skills. They don't have other things that they are good at. Overcoming communication barriers. As we said before, not a lot of people know sign language, and the fact that this community is able to overcome that is just amazing. Challenging the stereotypes placed on them by society, and engaging with their own community and culture and people who understand their experiences. So what historical events have influenced the hearing impaired and deaf population? In 1857, the Gallaudet University became a leader in deaf education. This university has been the global leader in education advances for deaf and hearing impaired students for over 150 years. The university was originally established as a grammar school for deaf and blind children, and in 1864 it began working toward becoming the higher education institution that we see it as today. It now offers over 50 barrier-free degree programs and funds $4.7 million in research for the deaf and hearing impaired population. Next, in 1886, we have William Hoy and his baseball career. William Hoy became both deaf and mute at the age of 3 due to a meningitis infection. He graduated as valedictorian from the Ohio State School for the Deaf. After graduation, he was recruited to play baseball for Oshkosh and became an outstanding outfielder. However, due to his inability to hear, he had trouble batting. This inspired Hoy to ask his third base coach to signal pitches. In the season that followed, he excelled in batting and unintentionally began the practice of signaling pitches, which is now common practice in baseball today. In 1960, sign language became recognized as a language. In the early to mid-1900s, sign language was not considered a true language, but rather a code for English. William Stokoe helped change this view by proposing that ASL was just as much a language as English. He published Sign Language Structure in 1960, and this encouraged others to publish books about sign language, such as the ASL Dictionary, ASL Linguistic Principles. Because of his impact, Stokoe is considered the founder of sign language linguistics. In 1961, we had the first cochlear implant developed. The idea of stimulating an ear electronically began in the 1790s when a researcher placed a metal rod behind his ear and attached it to a circuit. This experimentation continued into the 1850s, and by the 1930s it was understood that placing a current near the ear creates auditory sensations. It was at that same time that scientists discovered how cochlea works and that electrical energy can transform into sound before it enters the ear. By 1961, the first cochlear implant was invented, and 3 years later, one was successfully implanted at Stanford University. 1970 was the beginning of the use of closed captioning. The National Captioning Institute, or the NCI, is the reason we have our closed captioning technology today. The first form of closed captioning was developed in 1970. Only text was displayed on a television screen, so this was an unsuccessful attempt, but still an attempt. A year later, 2 ideas for captioning were proposed at the first National Conference on Television for the Hearing-Impaired. Another year, Gallaudet University created a closed captioning system in 1972. In 1990, deaf employment rates increased. The passing of the Americans with Disabilities Act in 1990 outlawed the discriminatory practices towards the deaf population. This exponentially increased employment and education opportunities for the deaf and hearing-impaired population. So a few resources that I found in the northern Kentucky and Cincinnati area were the Kentucky Commission on the Deaf and Hard of Hearing, Pathways, which offers counseling and therapy services for the deaf and hearing-impaired community, the Deaf and Hard of Hearing Institute, which is a social services organization, and the Hearing, Speech, and Deaf Center of Greater Cincinnati, which is a nonprofit with a focus on hearing and speech impairment. Here are my sources that I used. Thank you very much.